Why, for us, as we are seated, we shall be singing our miracle around the white name because
My name is Jacqueline Afuna. I work with SOS Children's Villages as a project coordinator for the Youth Mental Health Project. Our project title is Youth Mental Health, and the project is implemented in partnership of SOS Children's Villages and Mental Health Uganda, and the project is implemented in Gulu City and Wakiso District Local Government, and our goal is to strengthen the youth 13 to 19 years right to education and health, but also enabling young people to know about their mental health and how they can be able to promote mental well-being. Our outcomes are we want to normalize mental health problems, reduce stigma and discrimination, and then also promote accessible psychosocial support in targeted schools. Our target are schools, 8 schools. We have 4 in Gulu and 4 in Wakiso. This project, just like from its name, it is a youth-led project. The young people 13 to 19 years are nominated or selected in their schools, and when we select them, we train them. We train them on different aspects of mental health, but of course we look at a general understanding of what mental health is, what are the common risk factors, what are the common signs and symptoms of mental health conditions, what are the preventive factors, what are the common problems that young people face that expose them to mental health problems, and how can we prevent this. So when young people are trained, they are now they become mental health champions in their schools, and therefore these young people create awareness through various ways: poetry, music, dance and drama, whatever young people feel comfortable to do, they do it in their schools. But then also they provide psychological services, they provide psychological first aid, they provide psychoeducation on different aspects of mental health, and then also they refer peers within the school. We have the focal teachers, 2 teachers per school. They are also trained. So the focal teachers handle cases that are referred from mental health champions who are students. But also we have another category of youth called mentor champions. Mentor champions are youth with a lived experience of mental health problems, and therefore they use their experience to mentor, to support, and guide young people on how to manage or to prevent mental health problems.
My name is Tusebira Joshua, and I come from St. Charles Franga International Secondary School, Kakiri, and I'm a proud mental health champion. This mental health program started about 2 years back. I was then in senior 2, and the project coordinators and project officer had to meet the school administrators and gave them a certain criterion which to select the mental health champions. Mental health is basically well-being of somebody, the ability of one to cope up with the daily stressors, remain productive in society, and someone being able to recognize his or her abilities. And as a mental health champion, our main responsibility is to recognize, listen to what our peers tell to us, and link them to the immediate support that we can, because our main reason for being in school is to normalize mental health conditions, increase awareness, and eliminate the stigma that is surrounding mental health. So basically, a person suffering with a mental illness, which is the direct opposite of mental health, a person being unable to cope up with the daily stressors, unable to recognize his abilities, and the person is therefore unproductive in society, is we are able to recognize people who are suffering from such conditions basing on different traits. A person suffering from a mental health condition basically has a gradual change in traits and characteristics, ranging, take an example. A person can be an introvert. An introvert is a person who is a bit reserved, does not associate with everyone, but then a person can gradually change from being an introvert, and then the person is jumpy from nowhere. If a mental health champion is keen to that person's behavior, you can actually know that there is something that has led to that changing behavior, and that might be triggered by a mental health condition or anything like that. So as a mental health champion, you have to look out to that peer, try to listen to them, and then after link them to the possible support available. And it's not that that you are supposed to link them to anywhere, but there are some required personnel that are professionals in the field of mental health, and the ones that we have some in the educational field, like the focal teachers, the school counselors, and so on and so forth. But on the higher level, we have the mental champions, psychiatrists, psychologists, and so on and so forth.
Okay, my name is Namtebi Gloria Tracy Chizito. I'm from Mount of Olives College, Katiri. I'm in senior 2. I'm 15 years old, and I'm a mental health champion. Mental health champion is a term to refer to we people who help our fellow youth in our schools to deal with their daily stresses of life. We basically talk to them about mental health, support them psychologically through psychological first aid, psychoeducation, and referral to our focal teachers. Those ones were selected and trained to help students in school deal with their mental health challenges. This project has been of great impact in our school. That is to say, we mental health champions, through our trainings we receive, our focal teachers and our mental champions work in our communities, we're able to support our fellow youths in school. We basically heal through conversation. They talk to us about their mental health challenges. We help them, and this is of great benefit generally to our school in a way that since the mental health program came, people are able to open up what is disturbing them, what is challenging them, the hardships they face, and through conversations they're able to let out all that is hurting them, all that is paining them, hence promoting psychological well-being. Their emotions are able to be well again. Then through these conversations of mental health, it is able to help students improve on their grades. Since they reduce the stresses they have, they're able to talk about it. It heals their minds, enabling them to concentrate in classes, in exams, then passing.
From our assessment, we've reached over 7,000 young people with these awareness messages, and I want to appreciate the schools that you don't only depend on the ones we organize in March, but you do it routinely. We want to appreciate you so much. Before we started this project in schools, we conducted the baseline study, and one of the critical findings I want to share is that up to 36% of the young people in the 8 schools, cumulative figure, reported to be having prolonged feelings of sadness, which comes as a result of many factors. Others are social, others come from home, others are as a result of COVID-19, others are within the school setting, and of the 36%, the common sources of the sadness is from amongst young people themselves. 44% is contributed by young people themselves, and then 25% contributed by parents or family members, and then 12% is contributed by teachers. So in terms of looking for where sources of sadness happen from young people, you look at amongst themselves and the teachers and the parents. And then 20% of these young people have ever made an attempt of suicide. I know when you talk about suicide, some people hear it as abomination or something that is rare to talk about, but yes, young people contemplate suicide as a result of many factors. Some of them, they feel sad, they feel isolated, they feel not loved by their parents. Others as a result of bullying and corporal punishments that they experience in schools. And actually one of the commonest causes of sadness amongst young people is bullying and corporal punishment in schools. That was one of the causes they mentioned. And maybe I should pause at this. I know the Ministry of Education has passed a ban. There's a circular banning corporal punishments and bullying in schools. Yes, much as we have that circular, I want to say that corporal punishments and bullying are still common issues in schools, and they are a major trigger for mental health problems. So we need to go beyond the ban, but actually implement, enforce the policy, and also ensure that schools are putting in place measures. And I want to say that it's one of, as a result of knowing that bullying and corporal punishment is one of the common causes of mental health problems among young people, the youth, who are the mental health champions, conducted rigorous awareness creation on effects of bullying on the mental health of young people. And I must say that as a result of increased awareness on effects of bullying, today I must report that bullying in the schools where we are implementing this project has gone down. Even teachers have reduced, they've changed the approach to the way they handle indiscipline amongst young people. Before it would be canes, suspension, but now today we see teachers are using alternatives like having guidance and counseling, having reflecting sessions with the students, and also doing what we call a root cause analysis, understanding what could have triggered this student to behave like this. And now we see more listening, more talking as compared to punishment that was happening there before. And today many young people are in schools because the approach has changed. The suspensions have gone down, but now there is more talk therapy has taken the stage. So now, due to increasing talk therapy that is happening between teachers and learners, now we see that there is an improvement even in discipline, even there is better retention, because now learners who should have left schools are now in schools.
Corporal punishment in schools has been reduced. Teachers now know they resort to other alternatives of punishing students. The corporal punishments like hard labor, caning, this has reduced in the society, in the school societies. Children are able to live more freely in schools, happily, hence improving their educational statuses. They perform well, they're able to do everything well. This is helping the schools, and when it helps the schools, the country is also lifted up.
Talking about what the project does, we do awareness creation through various measures in schools. We do radio talk shows, we do essay writing competitions.
This project has been of great impact in our school. That is to say, we mental health champions, through our trainings we receive, our focal teachers and our mental champions work in our communities, we're able to support our fellow youths in school. We basically heal through conversation. They talk to us about their mental health challenges. We help them, and this is of great benefit generally to our school in a way that since the mental health program came, people are able to open up what is disturbing them, what is challenging them, the hardships they face, and through conversations they're able to let out all that is hurting them, all that is paining them, hence promoting psychological well-being. Their emotions are able to be well again. Then, through these conversations of mental health, it is able to help students improve on their grades. Since they reduce the stresses they have, they're able to talk about it. It heals their minds, enabling them to concentrate in classes, in exams, then passing.
Normally after doing quite a number of activities in the year, like awareness creation, essay writing, commemorating various days, especially those that touch the well-being of young people, commemorating World Mental Health Day, we always crown the year with what we call the annual boot camp. And this year we held our annual boot camp in Gulu. We held it in one of our project schools, that is Oche, Campion Jesuit College, and I must say that we brought together all the partner schools and the teachers and the focal teachers, the district officials, also the city officers were there. They participated. We had a psychiatrist. We had some mental champions who also came on board. So we come together to reflect on what we have had throughout the year. What are our achievements? What are our challenges? How did we manage to mitigate these challenges? And then it is also a time for us to have fun, to rewind and learn, unwind, and so that we refresh ourselves, but at the same time we also plan for the year ahead. We had a very successful activity in Gulu. Stakeholders who came were able to share a number of reflections on how the project has made impact in schools. What I can say is that we have registered increased awareness and knowledge on mental health. We have registered reduced stigma as a result of increased knowledge.
Many people have learned to face their fears, identification skills. We have learned making friends during approaching, sorting out the issues. We have made many friends. And then also we have the high thinking capacity. We are able to reason out. That's the skill also we have. And then we have gained self-esteem. And then we have knowledge. We have gained knowledge concerning mental health.
Then we had assemblies in our school where we have awareness held by most of us are prefects in our school, like the mental health champions. So we get minutes, like 5 or 10 every assembly, to talk about issues of mental health, to create awareness.
The lessons learned from the whole year, like from OCHE, we learned that mental health is as old as mankind, so everyone has been going through it. It's just that the initiative was only possible now, but it's okay. Then we learned that decisions are made basing majorly on your mental health.
My name is Chaya Francis. I'm here with Jacob. Yeah, Jacob. So we shall represent the 8 mentor champions who are in this project in Gulu district, Gulu city actually. So this year actually it has been quite more engaging than last year, the previous year. We had a lot of more activities actually than last year. Interesting, we also now increased from 8 to 10 mental health champions. The mental health clubs have been formed in schools, and a lot of things have been happening. So combined here I have the achievements and the activities that we had for this year. One is the awareness campaigns that ran in the schools. Now the awareness campaigns, where I would say this was very good, is because this year it was quite more organized and more successful than the previous year. So they were direct and specific. The topics were actually digestible to the students, the learners and everyone. Laibi College had topics on bullying, stigma and discrimination. Vanguard looked at drugs, bullying as well. Drugs and substance use, Gulu Senior looked at that as well. So the reach out for this activity was over 5,000 students, because the population of the students is quite big in the schools.
We have also reduced change in approach in disciplining learners who may be having conduct challenges. We have also registered increased integration and prioritization of mental health activities in schools. And then we are also seeing schools themselves coming up with their own local initiatives, like mental health clubs, like having mental health prefects in schools, like also training teachers so that on mental health, so that they can be able to know how to manage learners, but also manage their own mental health.
About this bootcamp, we are really privileged to have it. We want to request you people to send our appreciation, our donor partners in Norway, for sacrificing whatever they have to see that they give us, that we are boosted each and every other year.
Let us prioritize budgeting and planning for mental health activities in schools. The Ministry of Education, under the circular on prioritizing mental health in schools, has asked schools or institutions to earmark 1% of its budget towards mental health issues. But I don't know how, if this is effected in schools. It's one thing I want to believe is not very effective, therefore we need to enforce it. And why should it be 1%, because 1% can even be just a drop in the ocean. Many young people have issues. So if we can even look at better resourcing for mental health, have a genuine budget, have people, personnel to support, but also make mental health activities as a routine in the school culture, in the school system, it has both immediate, intermediate and long-term effects. We have seen through this project that schools now have reduced the time for disciplinary meetings. Okay, so how, that is, when you turn that into money, that is a huge that's a huge cost benefit to the schools. We are seeing that now parents are no longer incurring more costs of taking their children to other schools. Why? Because they are not suspended. If your child is indefinitely suspended from school, you will have to incur a cost of getting them another school. But how about the time lost? I would urge our government and Ministry of Education to look at having professional counselors in schools. We have seen some of our schools having professional counselors, and therefore when we have professional counselors in schools, we make the referral system within the school very easy, and students get real-time help. If someone is struggling, if someone is feeling suicidal, they need help at that particular time. So if we have a counselor in school, if a champion is able to identify a peer who is suicidal, they refer them to the counselor, you can save a life.
Really been given more and more and more, and we believe we have not remained the same. We are going to continue implementing what is expected of us as mental health champions and as vocal teachers, because you have equipped us with more knowledge. So we promise that we are going to implement the project in our schools more and more.
So there are so many, if we conducted a cost-benefit analysis of why mental health should be promoted in schools, we would find that we save a lot. We save a lot on physical health, we save a lot on mental health, we save a lot on even school running costs, we save parents. So there are so many benefits of investing in mental health. And therefore we need both financial resources, we need personnel, we need time, we need quite a number of things in schools that promote mental health. This project is a living testimony that mental health is much needed in all the schools, because we've done this in 8 schools and the results are quite amazing. So stakeholders out there, we hope that you can take this call and promote mental health in schools. Parents, we urge you to promote the mental health of your children.
Every person who has a problem behavior, or they are not mental well, they affect other people who are not, who are in their surroundings. And how you affect people around you is a measure of your well-being. If you affect people around you in a positive way, then that what you do, what you are doing or not doing is helpful to people. So ordinarily, somebody with a mental health challenge affects everybody around them negatively. If you're a problem person, if you are dysfunctional, there is a way you affect other people, and it usually triggers those people to act. It usually triggers those people to act. So we are making you champions so that you are triggered to act when you are affected by somebody around you. Are we together? So before this kind of training or workshop, you are not triggered because it is not your problem. You are not bothered. But hopefully this workshop, this camp, this boot camp, I think the word is boot camp, this boot camp makes you the person that is going to be triggered to notice and help that other person out there.